Hello everyone, let's continue the topic of staffing in nursing. Philosophy of staffing in nursing. Nurse administrators of a hospital nursing department might adopt the following staffing philosophy. So, philosophy we already know every institution or organization will have their own philosophy. So, nurse administrators, the administrators or the higher officials of nursing in a hospital or nursing department might adopt the following staffing policy philosophy. First one is, it is possible to match employees' knowledge and skills to patient care needs in a manner that optimizes job satisfaction. So it is possible to match employees' knowledge. If you have recruited a staff nurse with 3 or 4 years of experience, her knowledge, the skills to provide care to the patients in a manner that optimizes job satisfaction. At the end of the day, with her knowledge and skills by providing care to the patient, she should get job satisfaction. Yes, I have provided care for 4 patients today. I'm fully satisfied. So that job satisfaction should be there in nursing. Second one is, the master staffing plan and policies to implement the plan in all units should be centrally planned by nurse administrators. The master staffing plan. Okay. So that means the nurse administrators, the nurses who are in the higher positions like administrative positions, they will plan the master staffing plan for each ward, operation theatre, OPD, ICU, how many nurses in morning shift required, evening shift, night shift, they will provide the plan number of nurses, days for them, again weekly offs, everything will be planned in that master staffing plan and policies to implement the plan. They will also prepare the policies and they give some responsibilities and authority to the head nurse to follow this plan. In all the units should be centrally planned by the nurse administrator. All these rules, regulations, staffing plan should be planned by nurse administrators. Third one is, direct care should be provided technically by the nurses to chronically ill patients, including health teaching and rehabilitation. Direct care of patient care should be provided technically by the nurses to chronically ill patients, including health teaching. So, critically ill patients or chronically ill patients suffering with chronic diseases, those patients' care plan should require health teaching also to the family members or to the patient, and also rehabilitation, providing rehabilitative services to the patients, that has to be included and provided. The patient assessment and work qualification should be used to determine the number of staff to be assigned for the care of patients. Patient assessment and work qualification. So the assessment of the patient condition, that has to be done by the senior nurse with the help of the junior nurse. So if the senior nurse assess the condition and plan the care and other juniors implement the care, everything will go according to the plan and patient will get 100% quality care. So that kind of systematic process has to be followed. It should be used to provide the number of staff to be assigned for care of the patients. So for 5 patients, 1 senior nurse and 5 junior nurses. Like that, if it is allotted, the senior nurse will do some activities which are very important, like assessment, observation, recording, all that. Then junior nurses will implement the senior nurses plan. Okay. So this is the philosophy of staffing in nursing. After philosophy of staffing in nursing, next topic is importance of staffing in nursing. So why staffing is important in nursing? First one is key to other managerial functions. So this staffing in nursing is the key to the other managerial functions. This works as a key, very important step for the other managerial functions. Let's see what it is. Staffing function is closely related to other managerial areas of the business. So staffing function is very closely related to other managerial areas of business. So whoever is in the hospital or health business, staffing is their main function on which many other areas of business are related. It greatly influences the direction and control in the organization. So, for example, if you take one person has started a hospital, All the facilities he has provided, equipment is there, everything is there. But what is the use if staff are not there? So staffing is very important step with which other steps of the management are related. So that is very important. It greatly influences the direction. So staffing will help to direct the organization towards reaching its goal. The effectiveness of other managerial functions depend on the effectiveness of staffing function. If doctors are very excellent and equipment is there and patients are coming, like number of patients are visiting the hospital getting admitted. If nursing care is not good, if proper required number of nursing staff is not recruited, what is the use? Can a hospital run without nurses or proper good care? No. Even the hospital, very good doctors are available. Without the nursing staff, the hospital cannot reach its goal or provide care. So keep that in mind. So it is the key to other managerial functions. Second importance is building healthy human relationship. Staffing helps in building proper human relationship in the organization. Smooth human relations is the key to better communication and coordination of managerial efforts in an organization. Staffing, especially nursing staff, they are the one who directly freely communicate with the patient. All the time doctors don't stay in the wards to talk to the patients. They are the one who represent the hospital staff, nursing staff. So they maintain human relationship with the patients in the organization. If these human relations are smooth, that is the key for better communication and coordination of managerial efforts in an organization. If everything is good but the nursing care is not good, is the patient going to return to the hospital? No. Next time, if he want to admit, he will not get admitted. He will prefer some other hospital. So nursing staff is the main key people who are going to communicate to the patient, and he is going to carry the impression of the hospital management. So that is the second important, that is building the healthy human relationship. Third one is human resources department. Skill and experienced staff is the best asset of a business concern. Staffing function helps in developing this asset. It inculcates the corporate culture into the staff, which in turn ensures smooth functioning. Human resources department, nothing but HR department. So even software companies have HR, hospitals have HR, big education institutions have HR. So that department will take up the recruitment of process of the nurses. So skills and experienced staff. So if this HR department has very good, skillful and experienced staff, that is the best asset of a business concern. The people who are selecting the nursing staff to work in that hospital, if HR department has good people, they will select good nurses, experienced nurses. So that will be very helpful for the organization. This HR department will help in inculcating the corporate culture into the staff, which in turn ensures smooth functioning. Any recruit staffing problems, everything is dealt by the HR department. So that department should be very strong and filled with good experienced people. Fourth importance is long-term effects. Staffing decisions have long-term effect on efficiency of an organization. Staffing is very important. So that is the first main decision which has long-term impact on the efficiency of an organization. If you select a good number of staff and experienced people, that is the main key for the running of the organization. Qualified, efficient, good qualified nurses, professional, BSc nursing qualified or general nursing qualified nurses, and efficient who have good knowledge and skills, and well motivated staff. They should be well motivated to work, and they are the asset to the organization. It assumes special significance in the context of globalization, which demands high degree of efficiency in maintain competitiveness. Okay, it assumes special significance. It has a special importance in the context of globalization. If there is a good nursing staff, good doctors, experts, good surgeons, and everything is very good, that institution is going to get very good name, and it helps for globalization. Okay, so if one branch in Andhra Pradesh is providing excellent nursing care, definitely they will extend their services to the other state or other cities. Like that, that particular hospital will grow big, large, and it will move to the other cities and also even to the other countries. So all depends upon the staffing. Fifth importance is potential contribution. It is based on the ability of the prospective employees to meet the future challenges that the organization need to address. So potential contribution, nurses has to contribute to the development of the organization and future challenges. Okay, that means in future, if any pandemic comes, like we have seen COVID, so any such kind of pandemic is faced, if that hospital with good plan handles that situation, so it can meet the future challenges that the organization need to address. Okay, so they have some disaster management facilities, or they have trained nurses. They can face any type of emergency situation, or bomb blast happen nearby. So our hospital has very good trained nurses who can handle all kind of burns cases. So like that, if they face different types of challenges, that particular organization need to be addressed. So these are the five important importance of staffing in nursing. If you see next topic is steps of staffing. Okay, we have seen philosophy, importance, then steps. So if you are a nurse administrator, you want to do staffing, what are the steps which you have to follow? First step is determine the number and types of personnel needed. First of all, how many nurses are required, the number of nurses you have to identify, and the types of nurses like ICU nurses, experienced, 5 years experience or 3 years experience, or just freshers. How many freshers you require? How many senior nurses you require? How many operation theater experienced nurses you require? That information you have to determine first. That is the first step. Second one is recruitment. After getting the number and type of nurses you need, recruitment process you have to start. After that is nothing but giving notification in the newspaper, social media, or any platform you can give. Those people will apply. All the applications you have to sort out. Then send them a message. Come for the interview. The third step is conducting interview. If not, if you can also, before the interview, you can conduct a examination, entrance examination. After qualifying in that, you can call them for the interview. So in the interview, you have to follow all the protocols according how the interview has to be conducted, how many people will interview, all that will be taken care in this interview step. After interview, whoever performed well in the interview, you have to list out all their names and select for the required positions. How many nurses you want, those people you have to select. Then after selection, giving them joining orders. Once they join, you have to assign personnel. Okay, so assigning the personnel. After selection, if the nurses require any training, few days of training, orientation, that has to be given. Then assign the personnel. So ICU nurses you can assign to the ICU, OT nurses you can assign to OT. Like that, you have to distribute all the selected nurses. Then last step is induction and orientation. Any new institution, if staff members or students join, we will provide induction and orientation. We will give them some time to adjust to the new environment, new setup. Okay, you can show them or give them a few days, like 2 days of orientation, like where the equipment is available, where the linen is available, how the sterilization process happens in the ward, how the instruments are cleaned, where the stock is available, where the drugs are stored. All that you can explain and give orientation, the whole hospital orientation, where the lab is, where X-ray department is, where CT scan is, where the operation theater, each floor, all that physical plan has to be given orientation. Like this steps you have to be followed. in the process of staffing. Some other steps are also there. Either you can follow this or the previous one. This includes first step is manpower planning. Okay, planning how many people we require to work in the hospital, how many nurses. Second one is recruitment, giving the notification and sorting out all the applications, conducting an exam or anything. Then or according to their marks, you can select them. Or third step is selection process. By conducting an interview or exam, you can select them. Then placements. After selection, placement has to be given. So they have to work, place. Then training and development. If they require training, they are new to this or they are freshers. If they require training, you can give training and development. Some knowledge, some classes you have to take. You can take some demonstration of some procedures. That has to be done in this step. Then remuneration, paying them according to their experience, seniority, fixing the salary for them. That is remuneration. Then performance appraisal. Once they join in their job and performing their duties, after certain period, like every 6 months or every 2 months, they can get a performance appraisal, like assessing how they are doing their job. Are they good or very good, excellent, that kind of feedback they will get from performance appraisal. If their performance is poor, again they can be given some training and they are motivated to work hard. Like that, performance appraisal frequently it has to be done. Then promotion and transfers. If the performance appraisal, if they are performing very well, excellent, then you can give them promotion after working for 1 or 2 years in the ICU as a staff nurse. If that staff nurse is working very good, she has very good knowledge, she can handle patients, she can be given a head nurse position to the other ward or whichever area there is vacancy. And a transfer, you can even transfer that expert nurse to some other department. Like this, the staffing process goes on. These are the steps of staffing.